An estimated 5,000 people were at Queen's Park today to protest what they call the privatization of Ontario's healthcare system. They say the Ford government has been funneling tens of millions of dollars away from public hospitals and into private clinics. Is there anything specific you would want to see the government change?
A commitment to a publicly funded system that meets the needs of our communities.
What kind of things are you experiencing in your work?
Definitely staffing shortages, burnout are the two biggest ones.
I did have a chance today to ask the health minister about some of the accusations made during this protest. Here's what she had to say. I know that the government does make significant investments in the public system, but given the significant investments also in the private system and private clinics, are you willing to admit that your government is working towards a two-tier system at this point?
Absolutely not. It has never been an either or conversation, which frankly I think some organizations try to make it so. When we make the investments in both our hospital system and in our community, we're actually making more choices available to the patients.
Isn't that the very definition of a two-tier system though? Can you explain the differences to me then?
It absolutely means that individual with an OHIP card can make a choice about whether that MRI, that CT scan that they need and their physician or primary care provider has requested, they make a choice about where they want to have that. Could be in their community hospital, particularly as we expand MRI and CT access, and yes, it can be in a community facility that might be more convenient and closer to home.
They're transferring now hundreds of millions away from the public hospitals, which they pushed into deficit and forced into cuts, over to private for-profit clinics that they're expanding to take over their services, take their staff and their services and their money.